Today, I will be demonstrating how you can gain more time with patients by simplifying documentation. For today's demonstration, I will be dictating a jaw pain consultation. I will be using a mock EHR. We'll have a similar interaction with your EHR. You can see I have the Dragon bar open here. It is a drag and drop, so you're able to leave it in a convenient area, or you can minimize it and still dictate. I'm going to begin by showing some straight dictation. I will show some examples of editing. I will also show a macro command or an auto text, and then I will show some navigational shortcuts with straight dictation. For my first straight dictation, I'm going to change the speed in the manner that I dictate. I'll do it in a slow, consistent speed, and then I also do more of a fast pace just to show the accuracy and the flexibility depending on how you dictate. Let's begin. The patient is a 58-year-old male who was seen for evaluation at the request of Dr. Smith regarding recurrent jaw pain period. This patient has been having what he described as numbness and tingling along the jaw, teeth, and tongue period. This numbness has been present for approximately 2 months period. It seems to be there, open quote, all the time period, end quote. He was seen by his dentist and after dental evaluation was noted to be, open quote, okay period, close quote. He had been diagnosed with a throat infection about a week ago and is finishing a course of Avalox at this time period. He has been taking cough drops and trying to increase his fluids period. He has recently stopped tobacco period. He has been chewing tobacco for about 30 years period, again, There is concern regarding the numbness he has been having period. He has had a loss of sensation of taste as well period. Numbness seems to be limited just to the left lateral tongue and jaw region and extends from the angle of the jaw to the lip period. He does report he has had about a 20 pound of weight gain over the winter, but notes he has had this in the past just simply from decreased activity period. Let's now look at an auto text or a macro command. Our training team will cover these with you. They'll show you how to build and edit these as well as customize them if you'd like any fields or other advanced functionality with these. I'm just going to do a basic text one for this demonstration. New paragraph, normal ENT exam. Okay, so this was an example of the auto text preset command that I'm able to call in with a 2 to 3 word command. Okay, I'm now going to show some examples of navigational commands with some straight dictation. And let me scroll down a bit here so we can see. Okay, here we go. Next field. Other than those listed above or otherwise negative period. Next field. Pertinent for hernia repair period. Next field. Pertinent for hypertension period. Next field. Tylenol period. He is on Nicorette gum period. Next field. He is allergic to codeine, unknown reaction period. Next field. The patient is single, self-employed carpenter period. He chews tobacco or have been chewing tobacco for 30 years, about half a can per day, but notes he has been recently off, and he does note occasional moderate alcohol use period. Okay. Quickly navigating between fields and dictating. That was a breeze. Let's go ahead and continue down a little further. Let me scroll so that you can see. Alrighty. Next field. A fiber optic nasopharyngoscopy was also performed, period. See separate operative report and chart, period. This does reveal a moderately deviated nasal septum to the left, comma, large inferior turbinates, comma, no mass or neoplasm noted, period. Next field. I have ordered a CT of the head, period. This includes sinuses and mandible, period. This is primarily to evaluate and make sure there is not a neoplasm as the source of this numbness that he has had, period. On the mucosal surface, comma, I do not see any evidence of malignancy and no visible or palpable masses were noted, period. I did recommend he increase his fluid intake, period. He is to remain off the tobacco, period. I have scheduled a recheck with me in the next 2 to 3 weeks to make further recommendations at that time, period. Okay, so that quickly shows how we can navigate, use straight dictation, macro commands, editing, and quickly complete a note after visiting with our patient. We are able to offer a free trial. We'll have some information shown here shortly on how you can contact us. Please let us know if you'd like to conduct that free trial as a proof of concept. We'll be happy to make sure this is the right solution for you and ensure that you feel the same way. Thank you for joining us today, and we look forward to seeing you next time.